Figures out this morning show the unemployment rate has unexpectedly risen to its highest rate for more than 2 years as the job market weakens. A record number of people are now not in work since the pandemic, largely due to long-term sickness. More than 9.4 million people in the UK are neither in a job nor looking for one, and it's costing the economy millions. Our business correspondent, Paul Kelso, has been to Middlesbrough in the northeast of England, where a quarter of residents are inactive.
Oh, it's a bit smoky in here. Yes. I need to stop smoking so much in here. I do.
Michael is unemployed and lives alone. He's just enough space for his hobbies.
Keeps you busy, you know what I mean? It's something to do. Between that, teaching myself a bit of Latin and whatever else, it just keeps me out of mischief.
But after 6 years out of work, he's stuck in a rut and says he wants a job.
People must think like, oh, it's all right to be on the dole and not have to do anything, but it's boring. You know your money and when it's going to run out.
Michael's first steps back towards the workplace have brought him to the council-led employment hub in Middlesbrough, a front line in a workforce crisis driven by long-term sickness and mental health.
Economically inactive for the last 4 weeks, and there's no chance of you going back to work in the next 2 weeks, is that right?
That's holding the economy back and pushing the welfare bill up.
They get used to that pot of money that's coming in, and it's very difficult with the cost of living crisis at the moment. Sometimes it is a bit of a vicious circle that they want to work full time, but ultimately they'll be worse off with the benefits being taken off them.
It makes it feel like work doesn't pay.
You could say that, yeah, but it's that sense of achievement at the end of the week.
The balance between welfare and work is policed by job centres. If you're unemployed, you have to attend a weekly appointment, but those signed off sick don't have to look for work, a system that can be open to abuse.
We hear people talking about mental health and almost as if it's the new bad back, you know, it's an excuse. People get signed off and it's a way of playing the system. Would you recognise that?
Yeah. Yeah, well, I'm saying yes, definitely. We have to be able to, question, and ask, because not only is it our job to support the public, we've also got to protect the public purse.
The solution to the workforce crisis is often said to be to get tough, to make the benefits regime less generous, sick notes harder to come by. But the evidence here in Middlesbrough is it is not as simple as that. The impact of poverty and ill health means many people need an enormous amount of support before they can even think about getting a job.
Fantastic. Michael says he wants to work, but he knows his ambition is fragile.
I feel like I want to get back into work or something, and if I maybe don't do that, especially if like only yourself to talk to, sometimes you can you go backwards, you lose the confidence.
For the next government, rebuilding the economy means repairing the workforce.
Well, I'm joined now by Head of Social Policy at the New Economics Foundation, Tom Pollard. Good afternoon to you. So, look, it's really interesting because we get a lot of people saying that, of course, there's going to be people out of work. We've had a pandemic. There's long COVID to consider, and then the flip side, people are saying that there's people scamming the system. Surely there's some middle ground, right?
Well, I mean, to start, I don't think there is a huge amount of evidence that people are so-called scamming the system. It's not easy to get categorised in this way in the benefit system. You have to go through quite a lengthy, quite invasive assessment process. You have to present medical evidence. Lots of people who are really struggling with their health, particularly mental health, don't get assessed as unfit for work. So I think it's become a bit of a kind of common myth that this is something that you just kind of say you're unwell and that's it. You don't have to seek work. It's actually a lot more rigorous than that. And I think what we're actually seeing is quite a significant rise in poor health, particularly poor mental health. And that's both because of the pandemic, but those trends were on an upward trajectory prior to the pandemic as well. So this is a long-term problem. And a lot of it is about cuts to public services that are making it hard for people to access the wider support they need, particularly with health, the kind of quality of jobs at the lower end of the labour market, and the fact that people are having to get by on really inadequate incomes. And we know there's a really close relationship between the level of income people receive and their health, and people living in poverty are much more likely to develop poor health, particularly poor mental health.
Yes, so how do you bridge those gaps then, Tom? What could be done? Because there are jobs out there, people don't want to do them or can't do them, but also they're earning almost more being on benefits than they would if they were in work.
I think, again, that we have to be careful about that. I mean, the basic rate of universal credit is about less than a quarter of a minimum wage job. People who are out of work because of sickness get a higher rate of benefit, but again, it's still a lot lower than the minimum wage. So the idea, there are issues around kind of cliff edges and the transition back into work and how much of people's benefits they keep. But I think it's important to recognise that people living even on benefits where they're there because of sickness and disability are not living a comfortable life. They're living on very low incomes, and not many people would choose to be in that situation. So I think it's really important that we kind of challenge that. Of course, it's better if possible if people can be in work, if that's something they're capable of doing, but that work needs to be supportive of their mental health. It needs to be appropriate, and ideally it needs to be well paid and secure, because we know that being in poor quality work can actually be just as bad for your mental health as being unemployed. So this is about improving the quality of jobs. But for people who are out of work long term, it's about giving them a real sense of security and support. Whereas what the benefit system tends to do is to put a lot of pressure on people, place a lot of requirements on people, and offer people a very low level of support. And
So we're in an election campaign right now. Manifesto's being released. If you could give us, say, 3 bullet points, we've got about 30 seconds, of what a party could do to change things, what would it be? Granted, a lot of people can't work, but what would you recommend?
Well, we need investment in public services to address some of the health issues and wider issues people are experiencing. We need a benefit system that provides adequate support and provides genuine support rather than just placing pressure on people. And then we need to tackle the quality of jobs at the lower end of the labour market.
OK. Tom Pollard, Head of Social Policy at the New Economics Foundation. Thanks very much indeed. Good to have you with us.